Neighbouring India is set to begin vaccinating people against COVID-19 next month. A few vaccine candidates are likely to receive emergency approval from India's drug regulator within weeks. Two companies have already applied. India has a target of 300 million people to be immunised by early August. And for more on this, Neha Punya joins us from New Delhi. Neha, a massive challenge for India. What is the government's plan and what is the foreseeable obstacles?
Gearing up for the world's largest immunization campaign, these healthcare workers are taking part in a nationwide drill to test the delivery of vaccines. 300 million Indians are due to receive injections in the first half of this year.
It's a mock drill, just preparedness for further.
The first one is the relatively well-known COVID shield from AstraZeneca. It's been produced locally in India, although developed in the UK it's been produced by the.
Neighbouring India is set to begin vaccinating people against COVID-19 next month. A few vaccine candidates are likely to receive emergency approval from India's drug regulator within weeks. Two companies have already applied. India has a target of 300 million people to be immunised by early August. And for more on this, Neha Punya joins us from New Delhi. Neha, a massive challenge for India. What is the government's plan and what is the foreseeable obstacles?
That's right. It's a massive and a very ambitious plan that the government is talking about. 300 million people who will get the vaccine by mid next year. But the government says it's ready to start vaccinating people as early as January. The first in line would be frontline and healthcare workers, as well as people like policemen and other people who've been at the front lines of battling this pandemic. These will be 10 million people who will get the first jabs. And then, of course, this program will be scaled up. All of this dependent on emergency authorization coming through in the next 2 weeks. But once that does happen, setting all of this in motion quickly will be the need of the hour. The government says it has about 29,000 cold storage facilities that will be utilized to ensure these vaccines can get to every part of the country. Day-long vaccination programs will be run. There will be about 150,000 healthcare workers that will actually administer these shots to different people across the country. And about 100 to 200 people, the government says, will get the shot every single day. But there is vaccine hesitancy that's growing as well. A lot of people saying they're not sure about the efficacy of the vaccines that are being considered. They're concerned about side effects. And some actually also believe they might already have immunity against COVID-19. So overcoming that will be a challenge.
Neha, do we know which vaccine candidates are in the running for approval?
Well, the top two are AstraZeneca, which is the Oxford candidate, which is being manufactured in bulk here by the Serum Institute of India. It's the world's largest vaccine maker, and they've already started manufacturing this vaccine, saying they can get about 100 million doses to the Indian government by January. The other is Bharat Biotech. It's the only indigenous candidate that's a front runner for now. And the government says both Serum Institute of India and Bharat Biotech can jointly produce about 65 million doses a month. So that's what the government is banking on. But there's also Russia's Sputnik vaccine, which is now being trialed as well as produced in India. And we're being told that 300 million doses will be produced here. That's 3 times the number that was initially expected.
And Neha, could you just get us up to speed with the current COVID-19 situation in India?
Well, things are looking up, Steve. We've seen numbers drop to the lowest been in 5 months. For days now, India has reported less than 30,000 cases every single day. And experts say it looks like the situation is rapidly coming under control. The government maintains it hasn't slowed down testing. So experts are suggesting it could be because the virus has run through large sections of the population, which is why it's not spreading as rapidly as it was back in July when India had just 1 million cases. But in the next couple of days, we will see India's total COVID-19 tally cross the 10 million mark. There are concerns that with the winter months of January and February, there could be another big wave of infections. So for now, the government says it's not time to let our guard down, and a vaccine really is the only hope for the future.
Neha Punya in New Delhi. Thank you.
Serum Institute, which is the world's largest vaccine producer, and the institute has stockpiled tens of millions of doses for inoculation in India. Now, this vaccine is cheaper than the other ones produced by the other companies, and can be stored at higher temperature, which makes it easier to transport and administer and store. The second vaccine is the Covaxin, developed and produced locally by a company called Bharat Biotech. But experts have raised concerns about this vaccine because trials have not yet been completed. And unlike other foreign vaccine makers, they started seeking approval even before the trials were done, and phase 3 is still ongoing. They've also not published much data, and the findings have not been peer-reviewed. So critics are saying that it's being rushed through, the approval for this vaccine. But there is significant pride amongst the ruling party, BJP, and its supporters about the fact that it's locally developed and produced. But India's drug regulator has said that they would never approve anything that's not safe. And there is the ruling party, the government, is in celebratory mode. Prime Minister Narendra Modi was on Twitter saying that every Indian should be proud that both vaccines are made in India.
The vaccine coming.
We're not worried. To get rid of this pandemic, we have to get injected. I've been working in public health for the past year, and I want an injection, and to motivate others to do the same.
India's drug regulator has received a recommendation for approval for the AstraZeneca Oxford University vaccine for emergency use. It can be stored and transported under standard refrigeration. That gives it an edge over those that need to be stored at extremely low temperatures. It's also cheaper than the alternatives. Tens of millions of doses have been stockpiled and will be given for free to healthcare and frontline workers in the first phase. And more are being acquired fast.
India is perhaps the only country where 4 vaccines are getting ready at one time.
And those others include Covaxin, a locally developed vaccine from Bharat Biotech that has been recommended for emergency use by a panel of experts. But many are asking whether the vaccines will be effective or reach the right people.
We don't know how long the duration of immunity lasts. We don't know when they will reach people like vegetable vendors or, for example, fish sellers, or in the marketplaces, or in the manufacturing hubs where the spread occurs significantly in India. I'm not sure that the problem has been appreciated or the response is robust enough, because these groups which are being vaccinated are not really going to spread transmission within the general population.
The Serum Institute of India has partnered with the UK-based drug maker AstraZeneca to produce 1 billion doses for low and middle-income countries. But the anti-poverty charity Oxfam says 9 out of 10 people in the world's poorest places may miss out on a vaccine this year. Andrew Chappell, Al Jazeera.